Welcome to Mental Health Merienda, your snack-sized guide to mental health wellness. I'm Dr. Adeline Leon, licensed clinical psychologist specializing in neuropsychology.
And I'm Michelle Young, licensed clinical social worker. Since this is a new channel, just some information to share about us. So Adeline and I are two licensed clinical mental health clinicians, and we've been friends for almost 20 years. Our channel is called Mental Health Merienda because it's a reflection of our cultural backgrounds and what we envision for this show. The word merienda means snack in both Tagalog and in Spanish.
And so as a disclaimer, this is not intended to be a substitute or replacement for individual therapy, diagnosis, or treatment from a mental health and or medical professional. The information we're presenting is general and for educational purposes only. Please consult with a licensed professional if you're struggling with your own mental health and well-being. And if you're in crisis, please call 911, 988, or your local crisis hotline.
So for our second episode, we wanted to talk about something called imposter syndrome. Adeline, how would you define imposter syndrome? And I know that's a phrase that we hear a lot of these days.
Yeah, I've definitely, I feel like I've heard so much about it just the last 5 years or so. Imposter syndrome, it's a feeling of self-doubt in your intellect, your skills, or your accomplishments. And it's kind of ironic, but we tend to see it mostly in high-achieving people. We see that these individuals, they have difficulty internalizing their successes. And so instead, they experience this pervasive apprehension and this feeling of being exposed, like they're kind of a fraud. And even though there are many cases that they have been successful and there's verifiable objective evidence of this, they still have that difficulty with accepting their successes. And so actually the term has been around since 1978. It was discovered by Dr. Pauline Clance and Dr. Suzanne Imes. And technically they coined it as imposter phenomenon. And they noticed this self-doubt in women and in marginalized groups. And that's where the term originates from.
I think I like that phrase better, phenomenon over syndrome.
I think so too. It's more accurate. Yeah. It's syndrome makes it seem like it's a clinical diagnosis when actually it's not.
Exactly. Yeah, I think that's why I like the term or the phrase phenomenon or imposter phenomena better. And interesting that it's something that they saw in women. So as women ourselves, I think that's something we can relate to on some level. I know I've definitely felt imposter syndrome in my career as a woman, as someone who often feels like there's not that many people that look like me specifically in the rooms that I've been in for work and for different projects and things like that. I don't know. What about you, Adeline? As a psychologist, do you ever feel imposter syndrome?
Most definitely. So many times. I have so many examples of it throughout my career, throughout my life. I think the one that comes to mind the most for me is thinking about just the course of going through my PhD program. I was the only Hispanic in my cohort and one of the very few Hispanics even in the program and even amongst other individuals who were studying to get their doctorates in psychology when I went on for my training experiences. And it was very difficult because I felt like it was a combination of not having other people who looked like me and also having this sense of, people know that I'm not as competent. People don't expect me to be as competent because I'm not like them. I didn't come from a very advantaged background. I was around a lot of people who did and who seemed to know so much more about how to navigate that whole experience of graduate school. And so most definitely, I'm very familiar with what that's like.
Yeah, definitely. I think I like how you bring up you didn't come from an advantaged background, because I think too, sometimes I'll talk to different people, in my field or who have a master's or a higher level degree. And when they talk about their backgrounds, they're parents are also like doctors or some, master's level. And, that's not something like I don't have that background. My family, that's not what I had, at least from my parents. And yeah, it's just like this very different background, and it does make you feel different, I think, when you compare yourselves. And I think, we'll talk a little bit about comparing oneself to others, but that is something I think that adds to this. Yeah. So some common characteristics of individuals, in addition to being, women, like you were saying, and also people who are high achieving, some other common characteristics of people who often feel imposter syndrome also include people who tend to be highly self-critical, people who are perfectionists, people who fear being evaluated, because again, with imposter syndrome, you have that fear of you're going to be exposed. There's also this perceived inability to, like, you can't replicate your successes, like it was just like a one-time fluke thing. Also, a big one is being the type of person who denies your own accomplishments and your capabilities. Overall, just having a hard time internalizing your successes. And then also because of that, not being able to accept praise and anything positive, any positive feedback from others. You believe that others have a different or an inflated perception of you and your abilities. And then lastly,
you see a pattern in all of those.
Right? And then also people who tend to attribute their achievements to external factors like luck or just like a one-time thing, rather than it being an internal quality like their ability, their intelligence. And then they also feel guilty about being successful because they do think it's an external like luck factor rather than because of themselves. So as you said earlier, imposter syndrome, the name syndrome makes it misleading because it's not a diagnosis, but those who struggle with imposter syndrome can often have anxiety, depression, and some other mental health diagnoses associated with it.
And so to explain a little bit about the process behind imposter syndrome, it's actually affected by this process called the imposter cycle. What tends to happen is we see in these individuals that, let's say they're presented with some sort of projects that they need to do. Just to give an example, let's say that they have to do a presentation for a class. And so, especially if you factor in some potential anxiety about public speaking, that adds on to that even more. And so having that project to do can induce a lot of anxiety, self-doubt, worry. And so people who have imposter syndrome, they tend to go one of two routes. First one is that they either over prepare for it. So they may go above and beyond what anyone else would ever do to complete this project, looking up a lot of resources and things of the sort. Or they might take the second route, which is procrastination. So you think of the person who waits until the night before to complete a project. And so when you are then taking one of those two routes, let's say you complete the project, in this case, the presentation, and it goes well, and you have a lot of praise. And so the way that individuals can push back on that praise and the way that they can ignore it or just invalidate it is in the first group where they over-prepared. They can justify it and validate it in their heads by saying, oh, well, but I over-prepared. I looked up 50 resources for this. I had to work much harder to produce the same product that someone else would with much less effort. And in the second group, the procrastination group, that person might say, oh, well, I just got lucky. I did all this the night before. I barely slept. I must have just gotten lucky. I have no idea how I did that. And so without being able to really process that positive feedback, they continue feeling these feelings of self-doubt and that feeling like a fake, feeling like an imposter. And then, Michelle, like you mentioned, sometimes that can lead to more of a clinical diagnosis of anxiety or depression, or both.
Yeah, we both felt imposter syndrome at one point or another. I relate to the over preparation. I think that's kind of maybe how I end up going through that cycle. What about you? Do you relate to either of those two cycles?
Definitely the procrastination. So
we're like an example of both.
Yeah, and they're not even mutually exclusive because I've done both. Surprisingly, I've waited until the night before to do something and also over prepared for it. But most definitely, I definitely fall more into the second group where it's the procrastination group.
Yeah. So that's really, I don't know if we ever like gone that deep into our imposter syndrome talk with each other as friends. So I think that's really funny that we both like.
That's funny that we have, each of those groups. Yeah.
So it's not a surprise, I think, to know that imposter syndrome occurs more often in marginalized populations and in women, like you mentioned earlier. That feeling of being an imposter is made worse when you don't see people who look like you or share your background, as we have also mentioned, who are succeeding in your field or in your profession. So these feelings are also reinforced probably by stereotypes, systemic oppression, microaggressions. That probably all plays a role too.
Mm-hmm. And, I think about when it comes to ethnic minorities and women and everything that you just mentioned with oppression and microaggressions, it makes me think a lot about a related concept, which is stereotype threat. And with stereotype threat, you have this fear of confirming negative stereotypes about your race, your ethnicity, your gender, your cultural group, about some group that you belong to, that you identify with, actually, is what I should say more specifically. I actually did my master's thesis on stereotype threat, so I did quite a bit of research on it.
I know a little thing or two, right?
A little thing or two, yeah. Mine was specifically with women, and I had a lot of my friends and colleagues do a spatial reasoning task. Michelle, I'm sure you were one of those people.
I did. I remember it.
The task, yeah. I was expecting everyone to do it. And so with that, if you think about, so actually I'll stick to that same example of women. And so you could say there's a stereotype that women are not good leaders. And so the stereotype that some people might have is that women can be too emotional. I think that's something we've heard quite a few times, or that they're not assertive enough. And so myself as a woman, if I am aware of that stereotype about myself, about this group that I identify with, then I can have this fear where I don't want to confirm that stereotype. So maybe at work, I don't want to confirm this stereotype about being a poor leader or about not being assertive enough. And so that kind of, you could say, just to put it kind of simply, it could kind of psych you out.
Right.
And when it psychs
in the back
you out,
of your head.
Yeah. And so, and we, in women, and I'm focusing on women, but if you think about women of color, like you and I are, it is magnified even more. And so that definitely, it's not exactly the same as imposter syndrome, but I wanted to mention that because it's something that can most definitely be a huge factor that leads to imposter syndrome.
Yeah. And there's actually research that supports what you're saying. So, according to Lean In, which is a US organization that focuses on women in the workplace, women are less likely to be hired and promoted to these leadership or managerial positions. And in their 2019 research, they had shown that for every 100 men brought into a team and elevated into management, that only 72 women experienced the same thing. So men ended up holding more higher manager level positions. In their study, it was about 62%, while women only held 38%. And so that lack of role models for marginalized communities has a major impact on making people feel like they do or they don't belong in some of these workplace settings. In this situation, it was a corporate setting and other professional environments. So with all this talk about imposter syndrome, like what can people do about it? Well, the first and foremost thing I think is super important, and let me know if you agree, Adeline, is talking about it, right? One of the best things you can do about imposter syndrome and trying to do something about it is to talk about it. Talk about how you feel, talk about your insecurities, specifically with like colleagues, with friends, people who can be your allies, because you want to deal with it, right? You want to share what's going on. You don't want to hold it in. You don't want to suffer in silence. It also helps you identify who your allies are, who your advocates are, and people who can also, say like, hey, like, I think you're, actually doing really well, and to hopefully combat like some of those, like that negative thinking that comes with it.
Mm-hmm. And I think before I go on to the second point, another advantage of talking about it is that from my own experience dealing with imposter syndrome, it's very much of an isolating feeling because you feel like you're the one who's not good enough, like you're the one who doesn't know, your area of expertise or whatever it is that you're working on. You're the one who feels like you're not up to par with everyone else, and so its very essence is that you're comparing yourself to other people. And so if you talk to other people about it and say, oh, wow, I feel the same way, actually, oh, it's not just you, then you know that it's not anything that's wrong with me. It really normalizes it.
Exactly.
So that's been, I think, us having those conversations about our own imposter syndrome, Michelle, I think that's something that's helped me and other colleagues that I've talked to about it. But I think in addition to speaking to others about it, specifically speaking to your mentors, and really making sure that your mentors are aware of how you're feeling, and they can be excellent people, as hopefully you have good mentors, but they can be especially good at kind of validating your accomplishments, allowing you to recognize what all your progress and your growth, and it's something that it's hard for us to measure that in ourselves and to really see that in ourselves, kind of like, wow, 2 years ago, you're right, I had no idea, I didn't know anything about this topic, and now I'm able to talk to groups of people about it and write about it, and it's hard for us to see that in ourselves, and your mentors can be especially good at pointing that out to you and really encouraging that and fostering that.
Yeah, and definitely it's so important to have a mentor in your workplace. I think, when you're in grad school, you can probably a little bit more easier. It's a little easier to find mentors, but definitely in the workplace, mentors are so important to just, help you develop, professionally. And again, to address and show you that, hey, you've made so much progress, like compare yourself to a year ago and how much progress you've made. They can give you that objective feedback.
More important for marginalized groups too.
Definitely. And I think too, we said this already, and it's easier said than done, but try to avoid comparing yourself to others. At the end of the day, no one's perfect. And we have to acknowledge too that a lot of people feel this way. I mean, you and I talk about it. We both feel this way. We know people who've also felt this way. And just kind of going along with talking about it, when you do talk about it and see who your advocates are, who your work friends are that also feel the same way, I think it helps to not compare yourself and to not suffer in silence. So definitely, as much as possible, again, easier said than done, but to try not
easier said than done.
Trying not to compare yourself.
Mm-hmm. And something else why I mentioned with speaking to your mentors and the fact that your mentors can be very helpful in this process because they can help point out where you've grown. But a way that you can do that yourself is by tracking your successes yourself and journaling. And it doesn't have to be a actual journal, like a notebook, but just writing it down or typing it in some sort of document. And this could be especially helpful. It could be twofold, where it can help with any kind of imposter syndrome, but also at work, in a slightly separate topic, but at work, whenever you have your yearly evaluation and you're being asked about your accomplishments, and if you're trying to ask for a raise, it's always a good idea to have these documented because it's hard for you to think in the last year what you've accomplished. And so it could be helpful for that reason too, monetarily, but also to help with imposter syndrome.
Definitely. Also, another thing is also reframing your thoughts. So that helps with the imposter cycle is reframing your thoughts. So we daily affirmations, positive self-talk can help specifically with reframing your thoughts. I know for myself, when I'm having this, imposter syndrome related to giving presentations or speaking, or, oh, I'm not good at this. How did I get this job? What's, that whole cycle, reframing your thoughts to well, actually a year ago, I wasn't able to do a presentation to 20 people. Now at this point in my life, I'm giving presentations to 100 people and kind of seeing how far you've come. Actually reading the evaluations, I think sometimes people don't want to look at those. There's a time where I didn't like to look at those, but then when you actually do take a look at those, there's often positive feedback, more positive than negative. So I think that also kind of goes along with reframing your thoughts, and then I think all these kind of related, because that also helps you track your successes, right? So definitely that's something to do with imposter syndrome.
And I can say, Michelle, in the time that we've known each other, where I remember very clearly when you started in a position where you had to do presentations very often, and how that was difficult for you. And now, I mean, well, first we're doing this, so and so that's you. I think you've come a really long way.
Yeah, thank you. And then let me try to accept this compliment without.
Yes.
Thank
Make
you.
sure that you're welcome. Make sure that you take the compliment. I can say something very similar for myself.
Yeah.
When it comes to feedback with me seeing my patients, in my job as a neuropsychologist, I had a bit of imposter syndrome. It was my first job when I finished my training, and my job decided to have patients given the option to complete evaluations about the providers. And so I have quite a few patients who have, and I still, every time I receive the email saying you have new evaluations, it's always a little bit of trepidation when I open it, and they've always been very positive. And it's really nice to, first, it's very validating, and it helps make my job even more fulfilling. But also I get to see that there's quite a few patterns in the evaluations. And so it allows me to see myself the way that my patients see me, and the way that I'm that I present myself, that I'm not even fully aware of, but it's very positive and very validating. But when it comes to imposter syndrome, like we said at the beginning, this isn't exactly a clinical diagnosis, but there are cases where it can lead to anxiety and depression. And so if you find that that's the case with you, where it's more than just feeling self-conscious, and even despite all of these validations, and despite moving up in your career, or whatever the situation might be, you can always seek help from a licensed mental health professional. Likely individual therapy may be helpful. And so a trained clinician can help provide the tools to break that cycle. So that cycle that I mentioned earlier, and also address any underlying feelings that might be associated with it. Because if that's the situation, then it may be that there's some other experience that you've had in the past that is really relating, and that is really fostering that imposter syndrome.
Yeah. And just to also highlight, the key here is licensed, right? Licensed professional. So again, that's your licensed clinical social worker, like myself, licensed psychologist, like Adeline is also like licensed marriage and family therapist. I think licensed counselors. It all kind of depends state by state and country to country, but license is my, probably your best bet. So just something to keep in mind.
Yes.
All right. So that is all that we have for today. So again, I'm Michelle Young, licensed clinical social worker.
And I'm Dr. Adeline Leon, licensed clinical psychologist specializing in neuropsychology. Thank you for tuning in to the second episode of Mental Health Merienda.